Hello. Happy Monday, everyone. It's Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, May 18th. This starts our 10th week of response to pandemic COVID-19. We're here just to give you our daily update and answer a few of your questions. So this morning, when this report was compiled, worldwide 4.7 million cases of COVID-19 disease were being reported globally, with around 315,000 COVID deaths. In the United States, are just under 1.5 million cases of COVID-19 disease reported, with nearly 90,000 deaths. In Alabama, just over 12,000 confirmed cases of COVID disease, with 488 deaths. And in Mobile today, in our detailed report, we're reporting on 1,738 confirmed and probable COVID-19 disease. Again, those are combined in our total number. 204 or 12% hospitalized, and 101, just under 6%, who died from COVID illness. You know, sometimes when we're just reading the statistics, it can seem like we are only talking about numbers, but it's really important to remember that every digit in that number means someone's mother or brother or sibling or grandparent has either been diagnosed and hospitalized or died with illness. And here at the Mobile County Health Department, we have learned of a third of our coworkers who have had an immediate family member die with COVID disease over the weekend. So as I was compiling this report, I really had to take a minute just to reflect that, you know, it's hitting many of you very close to home, and we hope that everyone would take this serious, but certainly our hearts go out to those who have members of your family who've been hospitalized or who've died from COVID disease, like our family here at the Mobile County Health Department. So we wrap our hearts and hands around those families. So today our health officer had this comment: "I know these 2 months have been very hard for many people, especially our food, hospitality, personal service, and other small businesses. These are very unusual times, and as a community, we will prevail over COVID-19. Please protect yourselves, your families, friends, and our community. We thank everyone for their efforts and avoiding taking risks." And again, the things that you can do to protect your community and your family are wearing a face covering when you go out in public, wash your hands, cover your cough, maintain a 6-foot physical distance between you and anyone who's not a member of your household, stay at home if you're sick, disinfect surfaces. Please, please, please continue to help us fight this very challenging new pandemic on our doorsteps. So among our 1,738 cases, not much has changed about the distribution by age and sex. About 27% of them are older than 65, and the bulk of our confirmed cases are between the ages of 20 and 65. That's generally about 60-70% of everyone who has been diagnosed with COVID, but we still are seeing children being diagnosed with COVID. They generally have very mild symptoms, but we have had 15 children between the ages of 0 and 4 years old reported as COVID positive. As far as the rest of the statistics, 60% are female, 27% are white, 45% African American, and again, about 15% are healthcare workers. About 23% either reside at a long-term care facility or are employed at a long-term care facility. Around 20% have recovered, and we've added asymptomatic to our report. Looking at that information, it looks like about 8% of our 1,738 cases reported no symptoms after a positive laboratory test. So that's new information that we have added to our report. As far as the severe outcomes associated, so those that are hospitalized and have died, of the 204 that have been hospitalized, still we only have one less than age 25 that's been hospitalized, and the overwhelming majority, 90% of our patients who are hospitalized, are 50 and older. 54% female, 36% white, 57% African American. And of those that are hospitalized, about 42% have required intensive care while hospitalized, and around 23% have required mechanical ventilation. So again, the numbers are going up, but the descriptive statistics or the characteristics of those seems to be fairly stable. And among those that have died, so again, cumulative, we have 101, and 99% of them are over the age of 50. 78% of them are 65 and older. About half are male and half are female. And the race is more evenly split, with 50% African American and 43% white. And among those that have died, 85 have required hospitalization. 95% of them have had some underlying condition, and about 53% of them are associated with a long-term care facility. So half of our deaths associated with a long-term care facility. We're starting to see a very heavy Monday through Friday influence on the way cases are reported to us. So since there are no specimens collected on Saturdays and Sundays at most locations, we see a very low number of cases in the beginning of the week, and then it builds and builds towards the end of the week. So again, last week we saw the highest number of cases reported to us on Thursday and Friday. But on Friday we added 44 cases, on Saturday we added 33, and on Sunday we added 33 cases. And over the weekend, since our last report on Friday, we added 4 hospitalizations and 3 deaths. See, today we changed the way that we are presenting the zip code data. So if you check out our daily report, this map, which is much nicer than we've been able to generate internally, it also shows detail for the zip codes in the city of Mobile that had been requested for us, and we appreciate our colleagues at the mayor's office, the GIS professionals who've been assisting us with this, who will be assisting us. And starting this week, we will only be reproducing this map on Monday morning, so it will not change, doesn't change that dramatically over day anyway. But we're going to try to work with some of our city and county GIS partners to try to get some more informative information about the number of cases by zip code. All right, I believe that's all on the data that I wanted to mention. You might notice that on the Alabama Department of Public Health interactive dashboard, alabamapublichealth.gov, I've not looked at it, but they reported this morning that they are beginning to report on the number presumed recovered. So lots of people want to know about this. It's a really squishy number because it's really hard to try to figure out how many people have recovered when you're just trying to stay on top of interviewing everybody who's positive and symptomatic. But more on that as we try to get up to speed with the way the state health department is reporting the number recovered. All right, here are some questions. Let's see, let's start with Facebook. What is the protocol or process if a restaurant has a positive case with an employee? So what happens when a new case is diagnosed, and this is any new case, it doesn't matter if they work, where they work, they will be contacted, or we will attempt to contact them. The Mobile County Health Department disease investigators will call them and we'll ask them about their health, about their underlying medical conditions, about their symptoms, about where they have been during their infectious period. They will identify the names and contact information on people that they've been within 6 feet from for 15 minutes or more, regardless of if they were wearing a face covering or not. And then we will give them advice about, staying at home for a certain period of time and monitoring for symptoms and, seeking care if you start to see complications of your illness, that sort of thing. So public health is not, Mobile County Health Department is not authorized to release the name of a business that might have a case, but if we talk to a COVID positive worker, and if they explain to us that yes, they were at work during their infections period, then we will contact the people at their work and interview them to give them instructions on what to do. Sometimes we talk to the business owner if we're not able to get good information from the employees. Sometimes we will talk with the business owner who might be able to, for example, look at their video cameras and tell, if the case had close contact with any other co-workers and that sort of thing. So, or if we're missing information on how to reach those employees, then that's another example where we might reach out to the business owner. But again, we're not authorized to release that information unless there is an overwhelming public health reason to do so. And in COVID transmission, at least, we've not had that happen. So that's the way it happens no matter where you work when we investigate a case. Why does Mobile have so many more cases than other counties? We know, again, that about half of our deaths are related to outbreaks in long-term care facilities, so that's one thing that's driving our numbers up. We're not sure about, why we have many more cases than other jurisdictions in Alabama. I have said in the past that, with other communicable disease outbreaks, Mobile County's outbreak looks more like outbreaks that happen along the Mississippi Gulf Coast and into Louisiana than it does the northern part of our state, Montgomery and Birmingham. So it's, the demographics in Mobile are, and the socioeconomic status and all of that is much different than it is in Baldwin County or than it is in Jefferson County. And so it's really tough to try to draw a comparison about why we're having more cases. I can say though that Mobile County and Alabama as a whole is on the low end of the infection rate when you look at other states that surround us, like Georgia or Tennessee or Mississippi. So just to put it in perspective, if you're trying to compare, don't just compare us with Baldwin and Jefferson, but try to look at other jurisdictions as well. Somebody noting about the case count, already mentioned this. Here's a question we get a lot. Are cooks required to wear masks when preparing food? I've been to several restaurants and seen food staff not wearing them. So the current order by the state health officer, Dr. Scott Harris, on May 8th says only the restaurant staff who engage directly with customers are required to wear a mask or facial covering. And that's at all times while in regular interactions with patrons and guests. So someone working in the kitchen or washing dishes or, working behind and who's not interacting with customers would not be required under the state health officer's order to wear a mask at all times. Again, only those while in regular interaction with patrons or guests. Let's see, here are a couple from the media. That I said that nursing homes were going to start reporting more information about COVID cases because of new rules under CMS. Yes, they must register and begin reporting to CMS by May 31st. So start looking at the CMS site to see when they're going to be reporting more information and what information that they are going to report. The public will know it at the same time that I do, and probably sooner because I don't have time to surf all their websites. But again, the requirement is that they must register and begin reporting by May 31st. We know that many are already registering and starting to report, but again, I doubt that there will be public reporting on that until after that deadline passes. Here's a question about offering, looking for free antibody testing, and the story around this question, I think, is about people who've had COVID and recovered, wanting to donate plasma for use in COVID patients for plasma treatment. So we don't know where antibody testing is available, but I just wanted to read a couple things having to do with antibody testing. So in general, antibody tests are not recommended to diagnose someone with current infection. Antibody tests are required to have an emergency use authorization from the Food and Drug Administration, and as of May 14th, FDA has authorized 13 antibody tests for emergency use. So I only encourage you that if you do seek an antibody test, that you make sure that it's one of the 13 that has received FDA emergency use authorization. They're listed on their website. But the good news is, I don't think you need an antibody test in order to donate plasma. So on the American Red Cross website, they are soliciting, this message says, in coordination with the U.S. Food and Drug Administration, the Red Cross is seeking people who are fully recovered from the new coronavirus to sign up to donate plasma to help current COVID-19 patients. So this is certainly a way that you can help not just this community, but potentially patients across the U.S. So you can qualify if you are at least 17 years old and weigh 110 pounds. If you're in good health, so if you generally feel well, even if you're being treated for a chronic condition like diabetes or heart disease, and if you have a prior verified diagnosis of COVID-19 but are now symptom-free and fully recovered. So verified diagnosis probably means a result of a PCR test. I've not gone through this website fully, but there is a plasma donor eligibility form that you can fill out, walk through some questions, and the Red Cross will let you know if you are eligible to donate plasma to provide potentially some life-saving treatment for people who have COVID-19 disease. So certainly if you meet those criteria, please reach out to the Red Cross on their website and see if you qualify to be a donor. Okay. What else? I got some questions today about disinfecting schools, churches, businesses, daycares, drive-thrus, restaurants, and I just wanted to sort of quickly go through the cleaning and disinfection for community facilities. So, you know, parks, theaters, like I know some of those are not even open yet, but it's still a good idea to keep disinfecting. So this is on the CDC's website. So they have guidelines for cleaning and disinfection after persons suspected or confirmed to have COVID-19 have been in the facility. And again, it says breaks it down to timing and location of cleaning and disinfecting services if you have people stay overnight, or if you don't have people staying overnight. So like a school, a daycare center, an office, or some facility that does not have people overnight would have different recommendations than facilities that do house people overnight. There are guidelines about how to clean and disinfect hard surfaces, soft surfaces, electronics, linens, clothing, and other items that go into the laundry. Then there is guidelines on personal protective equipment and hand hygiene, talking about, when is it appropriate to use a disposable glove, how often should you clean your hand, other preventive actions, and then some additional consideration for employers about educating staff, developing policies for worker protection, training, different things that you can do with your staff to try to make sure that you keep your facility as clean and disinfected as possible. All right, last thing I want to mention, this is Monday, a new week. This Saturday, a drive-through rabies clinic will be held on May 23rd, 1:30 to 3:30 at Cuddle and Kisses on 11120 Meadowlark Road in Grand Bay. So if you have not already made plans for the Labor Day holiday, there is that drive-through clinic. That's a $12 cash payment, and again, you'll just stay in your car to respect the physical distancing and other guidelines. And then on May 30, there will be a drive-through rabies clinic from 1:30 to 3:30 at St. Elmo Feed and Seed on 9001 Highway 90 West. So information to help you plan. We need to make sure to keep our dogs, cats, and ferrets protected against rabies. The other thing that I'll just mention before closing is that CDC has published a report showing that in some jurisdictions, some public health jurisdictions have seen a decline in vaccination for school-aged children and in a decline in well baby visits and presumably due to the COVID outbreak, because people are staying at home and there aren't as many services available. And I just want to emphasize that, you know, the family health, the primary care division of the Mobile County Health Department is available for well baby, well child, and vaccines. And most providers are also available. So please remember to get your routine vaccinations for your children so that we don't end up with another outbreak on our hands of something else that is perfectly preventable through a routine childhood vaccine. It's really very important. So again, before I close, being sort of instructed here that I need to emphasize again about wearing the mask. So make sure it covers your nose, over your nose and under your chin, and you maintain that 6 foot physical distance. So thank you, and we'll see you tomorrow.